Hello, my name is Steve Steindel. I am an experienced, approachable nerd that wants to help guide AHIM into today's changing healthcare environment by serving on your board of directors. I do not come from the AHIM world, but have worked with AHIM professionals for decades. I am a trained research scientist. In 1975, it was time to go to work and began my career as a clinical chemist working at Piedmont Hospital, a 500-bed tertiary medical center in Atlanta. I got my credentials during those years. I am a registered clinical chemist, a board-certified laboratory director, and a licensed by Georgia as a clinical laboratory director. Time to fast forward to the early 1990s and focus on background directly associated with my quest for AHIMA board director. In 1992, I joined the Centers for Disease Control and Prevention as a supervisory health scientist. Given my background in laboratory standards, especially IT, around 1995 I started to work with other areas of CDC in making decisions on public health IT standards. I also chaired the standards committee at CDC involved with getting a handle on this newfangled thing called the Internet. In 1997, the Department of Health and Human Services mobilized all interested agencies to provide staffing to the committee empowered to advise the government on the emerging HIPAA law and associated regulations. I staffed that committee until my retirement in 2008. Since 2008, I've worked closely with senior AHIMA volunteers and staff through my position as chair and immediate past chair of the AHIMA Accreditation Commission. I participated in the last two AHIMA strategic planning sessions, presented at the Assembly on Education Symposium, and have participated in the joint meeting of the AHIMA affiliates since they started. I've observed that the board, House of Delegates, and CFAs have to regain their central role in realistic curriculum setting, credentialing, and leading the future professional direction for HIM. We need that organized presence respected by federal and state governments to prevent future roadblocks like the year delay in ICD implementation. Our 72,000 members are located across the country in all types of healthcare practices, from solo practitioners to multi-state provider systems, and all levels of payers. We need to become a unified force that can drive the direction of the IT systems fundamental to quality patient care. I hope to spend my tenure on the board focused on strengthening AHIMA so it is viewed as the professional body for care-based IT systems and information governance. Our structure to do that is in place, just the commitment needs to be better expressed, coupled with our collective engagement.